so we're not allowed to expose the parts that are to be covered and to be alone with a person of the opposite gender. This is the general ruling. This is in a general situation. This is not permissible in Sharia. However, exceptions are made in cases such as medical needs or necessity with a qualified clinician. Most of the fuqaha agree upon this, that there are conditions. So there has to be a medical need, right? There must be a hardship in getting a physician or a healthcare provider of the same gender, right? And the limit of khalwa and exposure should not exceed. So it should only be to the degree that it is required, not more than that. So what does it mean? Just going through those conditions, what does it mean that the medical need must qualify? So we talked about this, that that whenever there is a necessity, then whatever is impermissible, it becomes permissible, right? And for something to become a darura, so it has to be, in the case of labor and delivery, like, there is the life of the child or the mother, or, just the need to help the woman deliver the baby. But also if there is an important diagnosis that needs to be made, we work in an era where there's a lot of medical liability, and if certain physical exams are required to prevent medical liability and for educational purposes. So the fiqh has said that these are all needs, and so in this situation, exposing of the awrah or being alone with the patient would be permissible. The second principle that we talked about, right, al-mashaqqatu tajlibu at-taysir, that hardship begets facility. So if it's hard to find a healthcare provider that is of the same sex, or it's that kind of accommodation, or even for a healthcare provider, we can't transfer every patient that is of the opposite gender. The medical system would not work in that way. So in that situation, it would be permissible to examine a patient of the opposite gender, and also to be alone for the exam with the patient of the opposite gender.